Hi everyone! Today we are going to talk about 5 tips to help you have an unmedicated birth at the hospital. So tip number 1 is to avoid Pitocin. Pitocin is the synthetic form of oxytocin. And so oxytocin is the hormone that causes the uterus to contract during labor. It's produced through feelings of love and safety and connection. Pitocin can be a really helpful tool in certain circumstances where, for example, if maternal pathology were to arise, let's say you have preeclampsia and the baby really needs to be born soon in order for your life to be protected, Pitocin is a super helpful tool that can be used to induce labor or get labor started. Pitocin can also cause contractions to be stronger and longer and more effective if labor starts to stall out. The problem is that Pitocin is used very, very often, and many parents choose to agree to Pitocin per their care provider's recommendation without fully understanding the risks of Pitocin use. And often the problem that we're using Pitocin to solve could potentially be resolved through a natural tool, or just by waiting. Some care providers believe that everyone needs Pitocin, and other care providers only use Pitocin on a case-by-case basis. So the recommendations for Pitocin you receive may be due to hospital policy or your specific provider. That doesn't mean that every provider or hospital will offer Pitocin in the same ways. So the reason why avoiding Pitocin is important if you want an unmedicated birth is because when you receive Pitocin through an IV drip, which means Pitocin is continuously being infused into your body, it will not cross the blood-brain barrier. Pitocin molecules are too large. So what that means is that in a normal contraction, you'll have a wave of sensation and your body will respond to that sensation intensity by releasing the perfect amount of endorphins. Endorphins are your body's pain-killing chemicals, which means that they help your body to cope with the sensations of labor. So you have your own natural pain-killing system kind of woven into the entire natural birth process. And in this way, our contractions are never more than we can handle because our body always releases the perfect amount of endorphins. Your body will not give you a contraction that is more than you can handle. But Pitocin contractions are a little different because now your body's feedback loop is being surpassed and a medicine is being introduced to artificially stimulate contraction. And the amount of contractions you have and the intensity of those contractions are stimulated by the amount of Pitocin that is given to you. So instead of your body kind of working its way into labor and labor contractions getting stronger and closer together as labor progresses, the entire progression process and the entire process around how intense contractions are all part of nature's design. And now that's being skipped over and the intensity is now stimulated by how much Pitocin you're getting. So when I say Pitocin doesn't cross the blood-brain barrier, what that means is that when you have Pitocin in your system and you have an intense contraction because of that Pitocin, your body is not going to release the same amount of endorphins that it would in a normal contraction because it doesn't stimulate the same process in your body. And so this can cause contractions to be much more painful than natural labor contractions. I personally do not know many people who have had Pitocin induction and avoided an epidural because they described the Pitocin experience to be really intense. Some of the reasons why your care provider may want to recommend Pitocin is if your water breaks before you go into labor, if labor stalls when you arrive at the hospital, or if for whatever reason they want to speed up labor. They also may recommend Pitocin if they want to induce your labor. There are some evidence-based reasons why Pitocin should be recommended and can be helpful, and there are providers who recommend Pitocin out of non-evidence-based convenience and profit-oriented policies. If you want to learn more about what all of those policies are, what the evidence has to say about when Pitocin is helpful and when it can be avoided, you can learn more about that in the Pitocin lesson in Module 3 of my Peaceful Birth course. Step 2 is to move during labor. So hospitals are set up with the bed sort of being like the center stage of the show. Providers often want the person giving birth to be birthing on the bed, preferably in a position that is most convenient for the provider, and that's a bunch of bullshit. You have the human right to labor and birth in whatever position you choose, and probably the positions that are least convenient for the provider are going to be more convenient for you. Midwives have delivered babies and listened to babies' heart tones and assessed mothers in all sorts of positions other than being on their back. So even if your provider happens to be uncomfortable with it, know that you absolutely have the right to labor and birth in whatever position you want. And we have plenty of research on the use of position changes for pain management and moving in labor to speed the labor process and shorten the pushing phase. And we've also found that birthing in upright positions, so in hands and knees positions, squatting positions, standing, or kneeling or lunging, all take pressure off of your aorta, which is a blood vessel that runs under your uterus. When there is pressure on your aorta, like if you're lying on your back, that can decrease oxygen to you, which can then decrease oxygen to baby. So one of the best ways to support you in coping with labor and to support your baby in tolerating labor well is to birth in upright positions and have the freedom to move your body intuitively throughout labor and birth. We have research that I'll link in the show notes that illustrates that pain scores are significantly lower for moms who are laboring in upright positions and moving their body throughout labor intuitively, almost like they were dancing through labor. In order to work through your pelvis, your baby needs to be able to move, and they need to have space in different areas of your pelvis for them to be able to do their maneuvers to get through your pelvis. If there is congestion or tightness on one side of your body or the other, or if you're lying in one position for too long, it can make it hard for baby to navigate the pelvis in a good way. This can lead to more pain and discomfort for you because baby may be compressing on a nerve or putting too much pressure in one area or compensating in your pelvis in a way that doesn't feel good for you. When you have a lot of space in your pelvis, it feels easier for baby to pass through. There's often less pressure, less uncomfortable sensations, and less back labor. So one of the best things you can do to support your baby's position and to help you cope with labor well is to move intuitively throughout labor, to listen to your body, and to find the position and the rhythm that feels best to you. And stick with that position, stick with that rhythm until it's not working anymore. So if you're in one position and the contraction feels way too intense and like you can't cope in that position, try getting into a different position and consider using a tool like a rebozo on your back, leaning or rocking on the birth ball, or other kinds of tools and props to support your body in moving, rocking, swing, trying different positions until you find the one that works for you. Changing a position probably isn't going to take you from intensity to no intensity, but it will help you cope, and that is what matters. Step 2 is to use water. We have significant amounts of research on the use of hydrotherapy and water birth to decrease pain and help people have unmedicated births. Some hospitals are not offering water birth, but they do offer hydrotherapy, which means you can labor in the tub, but you cannot birth in the tub, which is really unfortunate. But other hospitals do allow water birth, which is really excellent. If there is any access to water at all, I highly recommend you consider trying it out. So this could mean that you get in the birth tub and you labor in hands and knees, in squatting positions or reclining positions in the tub. Or you could get in the shower, bring a birth ball into the shower and sit on the birth ball and let the water hit your back. Or you could bring gardening knee pads or just lay a towel in the shower and get in hands and knees leaning over a birth ball and rock back and forth with the water hitting your back. The research we have on hydrotherapy and water birth shows that using water during labor significantly decreases pain scores for people who are laboring. And it also increases satisfaction rates, which is super important information to have because that means that people who have access to water tend to have better experiences birthing their babies. In addition, using a warm compress on your perineum during the second stage when you're pushing or being submerged in the water and birthing in the water can decrease pain in the perineum and decrease the risk of experiencing the ring of fire. But if you're birthing out of water and you want your provider to be hands off when you're birthing your baby, which is one of the best ways that you can decrease your risk for tearing, I encourage you to have your partner apply the warm compress, or your provider can apply it as long as you feel confident that they will honor your wishes to take their hands off when your baby begins to crown. Step 3 is to hire a doula. In most hospitals, you will not receive continuous support throughout labor unless Plus, your nurses have the staffing and the time and the availability to not leave your side throughout labor. But often, especially in busy hospitals, providers will check in occasionally and nurses will check in intermittently to monitor you. This doesn't offer you a lot of continuous support, and you need continuous support, especially if you're wanting an unmedicated birth. Having continuous support from someone who has done this before, who has training and experience and a passion for supporting people and having birth experiences in alignment with their values is so helpful. We have a lot of research on the benefit of doulas and birth companions, and what we found is that the presence of a birth companion, meaning someone who is close to you, maybe a mother or a friend, is helpful. But if you want to really increase your likelihood of having an unmedicated birth without interventions, having a trained doula is the best course to take. Because trained doulas have specific tools and practices that they can use to help you cope with labor when labor becomes more intense. So instead of turning to medications, turning to other interventions, you can turn to them for emotional and physical support throughout labor and birth. And this can be helpful even if you have a partner, because sometimes there can be a lot of things happening, providers or nurses coming in, asking questions. And if your labor is long, your partner may need to step away to go to the bathroom or to eat a snack. So having another support person who can help you physically and emotionally stay by your side throughout labor can be so helpful and honestly life-changing. The last tip is to use evidence-based tools to help you decrease pain during labor. And so some of these tools include the use of aromatherapy. We have plenty of research that shows that aromatherapy can decrease anxiety and pain during labor. And to also have your own TENS unit. I just saw an ad for a wireless TENS unit. What? A TENS unit is a device that you can put on your back, and it has wires, or maybe it's wireless, that connects to another device where you can adjust the settings. It sends electrical impulses to the skin, which sends the impulse to your brain, basically tricking your brain into thinking that you're in pain, so your brain releases more pain-killing chemicals. This can be so helpful for someone who is having uncomfortable sensations in their back. TENS units are really not that expensive. I think they're around $30, so they're pretty affordable for most people to get. This is an evidence-based tool that you can use to decrease pain without any risk to you or the baby. And the last evidence-based tool I recommend is to use peanut balls and birth balls during labor. If you need to rest at all in labor, a peanut ball is a great tool to use, because if you're lying on your side in a peanut ball, you can lift your leg up high and rest it on the peanut ball, and that can help your pelvis open in a way that supports your baby being in a good position and moving through your pelvis in a good way. This is so important because if the baby is not in an ideal position, it can make labor more painful and longer for you. Birth balls are also excellent tools, and it's just important to make sure that the birth ball that you use is the right size for you. You don't want your knees to be pointing to the ceiling, and you don't want to be on your toes either. For more tips on how to have an unmedicated birth in the hospital, and for a full illustration of all the pain management tools available, you can check out my birth class in our group. And if you're not a part of our group, I encourage you to start your 7-day free trial, and you can access all the information for free. Thanks for listening, and I hope this helps.